Hi friends, hello, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to start a new beginning, new subject from the nursing. The subject name is Child Health Nursing or Pediatric Nursing. Today we are going to discuss a child health nursing subject point of view. Very important questions and answers, and also frequently asked questions are FAQ in previous exams. Till now we successfully finished so many subjects. I will mention again. NHM 2022 2 sets question papers answers solved, question papers 2 sets, and NHM 2023 January. In this year, first January month 2023 NHM paper also we discussed, and also subject from the nursing, nutrition, midwifery, anatomy and physiology, nursing foundation, medical surgical nursing, mental health nursing, and first aid. Recently we already finished one more thing, model paper related to the nursing point of view. Previous year question paper also we discussed recently, and last video we completed first aid related to the 100 questions. Very important questions. We already finished these many subjects. Today we are going to discuss a child health nursing point of view, 100 questions, and before discussion of the 100 question point of view, we will discuss related to child health nursing introduction and important points. Before moving on to topic, a small request friends, anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Please like a video, share the video to your friends. Please give your suggestion in comment section. While watching the video, anybody like the content, please give me like friends. Let's move on to topic, child health nursing we are going to discuss today. In child health nursing we are going to discuss, before FAQs we are going to discuss a introduction of the child health nursing, growth and development, sick child, disorders and health problems of a child, children with various disorders and diseases. We are going to discuss these many topics before the FAQs. First we will see the introduction related to the child health nursing. The child health nursing introduction is, pediatric nursing or child health nursing is an important branch of nursing. So the pediatric nursing or child health nursing is the important branch of nursing which deals with, means the child health nursing will deals with care of children from conception through childhood including adolescence. Means the child health nursing will deals with care of children from conception through child including the till adolescence. Here the child health nursing meaning we got. What is the meaning of pediatric? Pediatrics. The term pediatric is derived from Greek word. Pedia means child, atric means treatment, and ICE means branch of science. So pediatric means the child, treatment and branch of science here. Pediatric nursing or child health nursing is an important branch of nursing which deals with care of children from conception through childhood including adolescence. The term pediatrics derived from Greek word pedia equal to child, atric means treatment, and X means branch of science. Why I am repeating this means, actually in first pic that is greenish color background, so that is not visible to us, so that's why I clearly mentioning once again here. And thus pediatrics means the science of children care and scientific treatment of childhood diseases. Means pediatric means the science of child care and scientific treatment of childhood diseases. And also children are major consumers of healthcare. In India, about 35% of total population are children below 15 years of age. So here in India, about 35% of population, the total population are children below the 15 years of age only. Children always need special care to survive and thrive. So children always need a special care to survive because they have a low immunity power. So they need a special care to survive and thrive. So here the child health nursing introduction we know now. See the definition of child health nursing. Pediatrics can be defined as the branch of medical science that deals with a care of children from conception to adolescence in health and illnesses. Pediatrics refers to the comprehensive and continued care of children, and also it serves both in wellness and illness. Means pediatric can be defined as the branch of medical science that deals with the care of children from conception to adolescence in health and illnesses. We already discussed related to this content, this paragraph in the introduction of the child health nursing. Here pediatric refers to the comprehensive and continued care of children, serves both wellness and illness. Means the child health nursing and pediatric nursing will deals with illness and wellness also. Next, who is father of pediatrics? Who is father of pediatrics? Abraham Jacobi. He is the father of pediatrics. But here additionally, Abraham Jacobi often called the father of American pediatrics. So here the father of pediatrics, Abraham Jacobi. He is the father of pediatrics. Next we will see the objectives of child health nursing. To provide an excellent clinical experience in the management of pediatrics patients of all ages with a broad spectrum of illnesses and injuries. So here the main objective of child health nursing or pediatrics is provide excellent clinical experiences in the management of pediatrics patients of all ages with a broad spectrum of illnesses and injuries. Next we will see the growth and development. What is growth and development in child health nursing in children's? The process of growing and developing. The growth and development means the process of growing and developing. For example, for the growth and development, growth is an increase in physical size, like the growth of a sapling into a mature tree. Means, for example, for the growth and development, here tree is the example for the growth and development. In additionally, we will see the growth and development here. Between ages 2 to 10 years, a child will grow at a steady pace. A final growth spurt begins at the start of puberty, sometimes between ages 9 to 15. This is growth and development age. Next we will see the growth and development periods of development. Now we will see this one by one. The periods of development is prenatal development, and second one is infancy and toddlerhood. Third one is early childhood. Fourth one is middle childhood. Fifth one is adolescence. Sixth one is early childhood. Seventh one is middle adulthood, and eighth one is late adulthood. These all are the 8 periods of development. These all are the periods of development. Now we will see the growth and development. 5 stages of child growth and development. Here first stage is newborn stage, second stage is infant, third one is toddler, fourth one is preschooler, fifth one is school age child. These all are the 5 stages of child growth and development for the children's. Next we will see the sick child. What is sick child? Sick child means a child who has a contagious disease or shows other signs and symptoms of an acute illness. So the child is who is having a disease, or the child shows other signs or symptoms of an acute illnesses or diseases is called as sick child. Sick child will show some of the signs and symptoms or disease related to the acute illness. Is the child is called as sick child. Now we got the definition of the sick child. Here, how do you identify a sick child? Check the all sick children for general dangers. What are the general dangers we have to know? General danger signs is present if following. The child is not able to drink or breastfeed. The child vomits everything. Means here the child is not able to drink fluids, liquids, not eating properly, and poor breastfeeding, and Also, child if taking liquids or food something, the child will vomiting, means it is a child is having some of this sick. Here we will see one more danger sign. Child has had convulsions and the child is lethargic or unconscious, means in the children is having convulsions and child is lethargic or unconscious also. These all are the danger signs of the sick child. How do you identify a sick child? Means these all are the danger signs of the sick child. Next we will see the common disorders and health problems in a children's. Here the disorders and health problems in children's is common health problems. Now we are seeing here on the screen: fever, excessive cry, vomiting, diarrhea, constipation, abdominal pain, allergies, abdominal discomfort, abdominal distension, poisoning, developmental disorders, multiple injuries, foreign bodies, failure to thrive, and these all are the comes under the common health problem during the childhood. Not only common health problems we are having in children: behavioral disorders, congenital anomalies, nutritional deficiency disorders, fluid electrolyte and acid base disturbances, common communicable diseases in children, respiratory diseases, diseases of gastrointestinal system, liver diseases and heart diseases in children, childhood blood disorders, the disorders of kidneys and urinary tract, burns and skin diseases, diseases of central nervous system, and also endocrine disorders in children, IENT and orodental problems in children, musculoskeletal disorders and handicapped children, and child welfare. Not only one system, each and every system having some of the conditions, some of the disorders related to the children's. In shortly we will see congenital anomalies and behavioral disorders, nutritional deficiency disorders and diseases related to the gastrointestinal system. In the behavior disorders, child will having in behavioral problems in infancy, behavioral problems in adult, behavioral problems in childhood, and nursing responsibilities. Behavior disorders of children, we are having major responsibilities in behavior disorders. In congenital anomalies, we are having in the congenital anomalies, means in the congenital anomalies common in the heart problems also. In nutritional deficiency disorders, vitamin deficiency disorders, mineral deficiency disorder, protein energy malnutrition and community nutrition programs, the nurse responsibilities also we can see. And the disease of gastrointestinal system and liver disorders, these like diarrheal diseases, dysentery, malabsorption syndrome, ulcerative colitis, hypertrophic pyloric stenosis, acute abdomen distension and appendicitis, hernia, rectal prolapse, jaundice, hepatomegaly, liver abscess. Not only these conditions, so many disorders are there present in disorders and health problems in children's. We are dealing with so many disorders in children's. This is the child health nursing introduction related to the child health nursing or pediatric nursing. Next we will move on to FAQ related to the child health nursing. Very important questions in child health or pediatric nursing point of view. The first question: total lung capacity in a newborn. The total lung capacity in a newborn. Option A 400 ml, option B 200 ml, option C 150 ml, option D 500 ml. The total lung capacity in newborn, now we will see. At birth, the baby's lungs are filled with fluid, so they are not fully inflated, so the lung capacity is around 120 to 150 ml in newborns. Do you know that the maximum amount of air your lungs can hold? Your total lung capacity is about 6 liters. That is about 3 large soda bottle. For example, for the lung capacity in adult means the about 6 liters, that is about 3 large soda bottles. Our lung mature by the time of 20 to 25 years of old, means in the age of 20 to 25 years of age our lungs will mature. But here in newborns, the lung capacity, the total lung capacity in newborns means 150 ml. Here option C is the correct answer. But the lung capacity is around 120 ml to 150 ml in newborns. Here option C is the correct answer. Here 150 ml. Next we will move on to question number 2. What age child will grasp a object in hand? What is the age of child will grasp a object in hand means the grasping. What is the age? Grasping age in the children. We will see here option A 8 months, option B 4 to 6 months, option C 9 to 11 months, option D 12 months. In infants develop their reaching and grasping from making just contact with their hands to using their palms to contact an object. Infant grasp is an extension of reaching and develops between 4 to 6 months of age. Here is how grasping involves 4 to 6 months. I will explain. The ulnar palmar grasp and radial palmar grasp all build the full hands grasp, beginning with the few fingers and eventually using the themselves. You means the eventually using the thumb to hold an object. So here option B 4 to 6 months. The age child will grasp a object in hands is option B 4 to 6 months is the correct answer. But in case of premature newborn or low birth weight babies, the milestone will delay up to the 8 to 10 months. Means the premature newborn or low birth weight babies will develop the grasping, not only grasping milestone, other milestone also delayed in the children's. But normal child age of 4 to 6 months they will grasp a object in the finger. So here option B is the correct answer. Next we will move on to question number 3. While taking temperature of child through rectal route, the thermometer should be inserted about. Means we are taking a temperature of a child through the rectal route. The thermometer should be inserted about how much? We will see here option A 1 inch, option B 2.5 inches, option C 1.5 inch, option D 2 inches. How we have to monitor temperature in the rectal route? We will see the step by step now. The steps to take a rectal temperature. We have to lay the child on their stomach and spread the buttocks apart or place them on their back with their knees pulled up. Insert the bulb end of the thermometer into the anal canal no more than 1 inch. Keep the thermometer in place until it beeps or for at least 1 minute. So here option A 1 inch is the correct answer. While taking temperature of the child through rectal route, thermometer should be inserted about 1 inch is the correct answer. Note, before inserting the thermometer in the rectal route, we have to put some petroleum jelly on the end of the thermometer and the anus. In case of babies less than 6 months old, we have to insert the thermometer is half inch to 1 inch we have to insert. In case of less than 6 months child, we have to insert the thermometer in the rectal route half inch to 1 inch only. So here while taking temperature from the rectal route, thermometer should be inserted. Option A is the correct answer, 1 inch. Next we will move on to question number 4. What is the meaning of cryptorchidism? We will see here option A inflammation of testis, option B undescended testis, option C big testis, option D inflammation of the penis. What is meaning of cryptorchidism? We will see now. A condition in which one or both of testes fail to descend from the abdomen into the scrotum. The exact cause of an undescended testis is unknown. So here option B undescended testis is the correct answer. Here the exact cause of the undescended testis is unknown. A combination of genetics, maternal health and other environmental factors might disturb the hormones. So here the meaning of cryptorchidism is undescended testis. Option B is the correct answer here. In additional, we will discuss related to the cryptorchidism. Cryptorchidism is associated with impairment of germ cells maturation and subsequent infertility in adulthood. The estimation that 5 to 9% of all men who develop testicular cancer have a history of persistent cryptorchidism. So here the meaning of cryptorchidism is undescended testis. Here option B is the correct answer. Next we will move on to question number 5. The virus does not cause bronchitis is. Here from the following option, the virus does not cause the bronchitis. We will see here option A mycoplasma, option B Coxsackie, option C influenza, option D hepatitis. Here Coxsackie virus are part of the enterovirus family of viruses that can live in the human digestive tract. The viruses can spread from person to person unusually on unwashed hands and surfaces contaminated by feces, where they can live for several days. So here the virus does not cause the bronchitis. Here option B Coxsackie. Coxsackie will spread through the nose secretions or throat discharges and also oral saliva. This is the transmission mode of transmission of the Coxsackie virus. Here the signs and symptoms of the Coxsackie we will see now. The fever, poor appetite, runny nose and sore throat can appear 3 to 5 days after the exposure of the Coxsackie virus, and blisters like a rashes on the hands, feet and in the mouth also we can see the infection. The bronchitis can common cause for the here not cause bronchitis means here option B Coxsackie is the correct answer. The causes of the bronchitis is rhinovirus, adenovirus, influenza A and influenza B viruses and parainfluenza virus and also hepatitis also. Here option B Coxsackie is the correct answer. Next we will see the question number 6. What is the normal range of Apgar score? Before discussion of Apgar score, we will see option A 4 to 5, option B 6 to 7, option C 7 to 10, option D 5 to 8. What is Apgar? Apgar stands for appearance, pulse, grimace, activity and respiration. Here A means appearance, P means pulse, G means grimace, A means activity, R means respiration. Apgar score is a quick test performed on a baby at 1 and 5 minutes after the birth. The Apgar score is based on a total score of 1 to 10. The higher score, the baby better the baby is doing after the birth is normal means the score, Apgar score will be 7, 8 or 9. The normal Apgar score is 7 to 10. So here 7 to 9 is there here, but here option C 7 to 10 we are having in the options. So here option C is the correct answer. Here the normal range of Apgar score is option C 7 to 10 and is a sign that the newborn is good health. Means the Apgar score is normal means the newborn baby is good healthy. So here option C 7 to 10 is the correct answer. Next we will move on to question number 7. Child with vascular ring usually present with the symptoms. Here child is having a vascular ring. The signs and symptoms like we will see here option A cyanosis, option B syncope, option C swallowing difficulty, option D all of the above. What is vascular ring? Vascular ring, if a vascular ring presses against the trachea and esophagus, it can be leading to a breathing difficulty and digestive problems. Here, what is vascular ring means the double aortic arch is most common symptomatic vascular ring. Approximately 50 to 60% of vascular rings are double aortic arch type of vascular rings. Vascular ring occurs very early during the baby's development in the womb itself. Normally the aortic develops from one of several curved pieces. The signs and symptoms like noisy breathing means stridor, wheezing or coughing, respiratory distress, swallowing difficulties, respiratory infections, and gastroesophageal reflux disease GERD, difficulty feeding. When you introduce solid foods, the baby will not take. So here swallowing difficulty and wheezing. Here the complaint signs and symptoms is here swallowing difficulty is the correct answer here. Next we will move on to question number 8. Involuntary passing of urine is called as. Involuntary passing of urine is called as. We will see here option A enuresis, option B tics, option C polyuria, option D oliguria. Here the involuntary passing of urine is also called as bedwetting. The bedwetting involuntary passing of urine is called as natural enuresis. Here nighttime loss of bladder control or bedwetting. Usually in children's, bedwetting can occur up to age of 5 years, a part of normal childhood development. Some cases in adults it can be caused by alcohol intoxication. So here involuntary passing of urine is called as enuresis. Enuresis is a repeated inability to control urination. Here involuntary passing of urine is called as option A enuresis is the correct answer. Enuresis can happen in children during the day or at night. Has many possible causes includes anxiety, constipation, genes and caffeine. Enuresis is in many cases it goes away over time and does not need to treat it. So here option A enuresis is the correct answer. Enuresis. Next we will move on to question number 9. Damage of facial nerve occurs if the facial nerve is damaged. So in the damage of facial nerve what will happen? We will see here option A hemiparesis, option B Bell's palsy, option C Erb's palsy, option D none of the above. We all know facial nerve. The damage of facial nerve means the damage of 7th cranial nerve. Facial nerve is 7th cranial nerve. The Bell's palsy is the correct answer here. Bell's palsy is an unexplained episode of facial muscle weakness or paralysis. It begins suddenly and worsens over 48 hours. This condition results from damage to the facial nerve. This is the 7th cranial nerve, and pain and discomfort usually occurs on one side of the face or head. Patient will feel episodes of severe shooting or jabbing pain that may occur like electrical shock. So here option B Bell's palsy is the correct answer. We can treat the damage of facial nerve means Bell's palsy we can treat through the several surgical options are available. Here option B is the correct answer. Next we will move on to question number 10. Kernicterus. Kernicterus is a pathological condition of from the option. We will see here options first. Option A liver, option B heart, option C brain, option D lungs. Kernicterus is a type of brain damage that can result from the high levels of bilirubin. So here jaundice also involved. But the kernicterus is a pathological condition of jaundice, but the type of brain damage. So here option C is the correct answer. Kernicterus is a pathological condition of brain. But in detail we will see. Kernicterus is a type of brain damage that can result from high levels of bilirubin in a baby's blood. Kernicterus also causes problems with vision and teeth. Sometimes can cause intellectual disabilities also. We will see the signs and symptoms of kernicterus. Poor feeding, irritability, high pitched cry. The baby will cry loudly, and lethargy, apnea, muzzle become unusually fluffy like a rag doll. The diagnosed kernicterus will diagnose. How we will diagnose? Most often diagnosed in babies. One test that may be used to check bilirubin levels by placing the meter on baby's head. So here option C brain is the correct answer. Here I want to ask one question. Please friends mention what is the meter. The bilirubin levels How we will check the bilirubin levels in the babies? By placing the meter on the baby's head. I was mentioned in the explanation. But with bilirubin levels, how we will check? Please mention your opinion, your answer in the comment section. Which of the meter means the bilirubin levels, how we will check in children? Please give your answer in the comment section. So here kernicterus is the pathological condition of brain. Option C is the correct answer. Next we will move on to question number 11. The common nutritional problems of Down syndrome. Here with Down syndrome, child is having Down syndrome. The common nutritional problems. With the nutritional problems, how the Down syndrome we will get? With the which of the deficiency? We will see here option A minerals, option B anemia, option C rickets, option D vitamins. The common nutritional problem, people with Down syndrome may deficient in vitamin B12 and may benefit from supplementation. The red blood cells of people with Down syndrome are unusual in ways that suggest either vitamin B12 or folic acid deficiency. Only one study has found lower levels of B12, vitamin B12 in Down syndrome as compared with normal healthy individuals. So here vitamin B12 can deficiency cause birth defects also. The birth defects like neural tube defects. Not only neural tube defects, vitamin B12 deficiency will caused by the megaloblastic anemia also. But here common nutritional problems of Down syndrome in children. Here option D vitamins can be cause for the low levels of the vitamins in the. So here option D is the correct answer. Next we will move on to question number 12. What is omphalocele? What is omphalocele? Option A hiatus hernia, option B herniation of intestine, option C inguinal hernia, option D none of the above. What is omphalocele? It is a birth defect of the abdominal wall. So we got the meaning of omphalocele. The birth defect. Omphalocele is a birth defect in the abdominal wall. In detail we will see now. In omphalocele, in the infants, intestines, liver or other organ stick outside of the belly through the belly button. Most babies with omphalocele do well. The survival rate is over 90%. How we will diagnose the omphalocele? The diagnosed usually means the omphalocele diagnosed usually made by prenatal ultrasonography. During the second trimester of pregnancy, we can identify the through the prenatal ultrasonography about 20 weeks of the time. Here we can identify. If we are identified in ultrasonography, the doctor will advise for the amniocentesis, for the examination of the amniotic fluid. So amniotic fluid amniocentesis is recommended to evaluate for chromosomal abnormalities. Here omphalocele, the meaning of omphalocele is herniation of intestine. Meaning of omphalocele is birth defect in the abdominal wall. So here option B is the correct answer, herniation of intestine. Next we will move on to question number 13. A nurse caring for a child with the diagnosis of meningitis. What are the signs and symptoms indicates an increase in ICP, intracranial pressure? Here the nurse is carrying a child with diagnosis of meningitis child. So the signs and symptoms indicates to increase in intracranial pressure. We will see here options. Option A high pulse, option B bradycardia, option C decreased systolic blood pressure, option D tachycardia. What is meningitis? Meningitis means inflammation of brain and spinal cord membranes, typically caused by an viral infection and bacterial infection. Here we will see the signs and symptoms. The signs and symptoms indicates to increasing in ICP, intracranial pressure, we will discuss now. Increased intracranial pressure is when the pressure inside a person's skull increased suddenly. It is a medical emergency. The main symptoms are bradycardia, also known as low heart rate, irregular respiration, and a widening pulse pressure, headache, confusion, decreased alertness, nausea, vomiting, blurred vision, lack of energy. The common causes of high intracranial pressure is a blow to the head. Cardiac slowing during the elevated intracranial pressure could be due to the direct activation of the central nervous system center. So here the nurse caring for a child with diagnosis of meningitis, the signs and symptoms indicates intracranial pressure means the option B, bradycardia, is the correct answer. In case of the child is having heart rate low heart rate means that indicates to increasing the intracranial pressure. So here option B is the correct answer. Next we will move on to question number 14. In which of the following is killed vaccine? From the following option, one is the killed vaccine. We will see here option A BCG, option B OPV, option C rabies, option D MMR. After the virus is grown, it is purified away from the cells and treated with a chemical that completely kills the virus. The rabies vaccine is like influenza and hepatitis A vaccines, a killed viral vaccines. So here no doubt option C rabies is the correct answer here. Human rabies is a 100% vaccine preventable disease, yet it continues to kill. Rabies vaccination are highly effective and safe and also well tolerated. So here the following option killed vaccine is rabies. Not only rabies, here influenza and hepatitis A vaccines are the killed viral vaccines. Not only rabies, influenza, hepatitis also is there, but here in this option rabies is there, option C. Here correct answer. Next we will move on to question number 15. A child with ulcerative colitis, nurse should be aware of. Here the child is having ulcerative colitis. The nurse should be aware of option A abdominal distension, option B abdominal cramps, option C profuse diarrhea, option D abdominal pain. The most common assessment finding in a child with ulcerative colitis is profuse diarrhea. The main symptoms of ulcerative colitis is bloody diarrhea with or without mucus. Common symptoms of ulcerative colitis are cramping, belly pain and diarrhea. Other symptoms like blood in the toilet, on toilet paper or in the stools. The complications of ulcerative colitis is delayed growth hormone development, severe dehydration, perforated colon, bone loss, skin infections and inflammation to the eyes and joints. The treatment of ulcerative colitis is drinking more fluids, eating more frequent smaller meals, not drinking carbonated drinks, not to eat high fiber diet, and also the ulcerative colitis child or person have to maintain dairy for the food. Here the ulcerative colitis we can treat, but if you are not treating the ulcerative colitis may lead to the colon cancer also. So here the child with ulcerative colitis, nurse should be aware of profuse diarrhea is the correct answer here. Next we will move on to question number 16. In neonates, chest compression and ventilation ratio. Here in neonates, what is the chest compression and ventilation ratio? We will see here option A 1:2, option B 3:1, option C 2:1, option D 4:1. The neonatal resuscitation guidelines recommended a 3 compressions is to 1 ventilation ratio. So 3:1, 3 compression and 1 ventilation ratio. Chest compression should be delivered at rate of 90 per minute, synchronized with ventilations at the rate of 30 per minute. So here for minute we have to give 90 chest compressions and 30 ventilations to achieve a total of 120 events. Procedure of chest compression and ventilation ratio in the neonates. Put 2 fingers in center of the baby's chest and push down a third of depth of the chest. Release the pressure allowing the chest to come back up. Repeat this 30 times at a rate of 100 to 120 pumps per minute. So here we have to maintain the ratio is 120 means 90 compressions and 30 ventilations. In the screen we can see here in the neonatal chest compression and ventilation. So should be 3 compressions and 1 ventilation. So here the neonat chest compression ratio ventilation ratio is 3:1. Option B is the correct answer here. Next we will move on to question number 17. When the body mass index is less than 18.5 is indicates to. Here the body mass index is less than 18.5. It is indicates to. We will see here option A overweight, option B normal weight, option C malnutrition, option D obesity. The body mass is to measure of body fat based on the weight in relation to the height, and body mass index is the tool to calculate health issues related to the individual's weight. Apply to adult men and women. BMI body mass index is a person's weight in kilograms, kgs or pounds divided by height in the meters. So here in this picture we can see the BMI rate. Overweight, normal weight, malnutrition, obesity is there in option. We will see here in this screen the picture. This is the classification by WHO, World Health Organization classification for the body mass index and weight status. 18.4 and below is underweight, 18.5 to 24.9 healthy, 25 to 29.9 is overweight, 30 and above, 30 above is obese. So here the body mass index in the question body mass index is less than 18.5. It is indicates so. So here option malnutrition is the correct answer. So here less than 18.5. In this question 18.5 is there. In the first box, first column 18.4 is there. So it is indicates to underweight. So here malnutrition is the correct answer. How we will calculate the BMI body mass index? Here we can see in this screen the formula. BMI equal to weight divided by height in squares. Weight should be in kilograms or pounds. The height is in meters. Next, according to the Centers for Disease Control and Prevention or CDC, the kids with BMI between the 5th and the 85th percentile fall with normal and healthy range. The factors affects BMI is genetic factors, lifestyle, economic factors and psychological factors. So here the body mass index less than 18.5 is indicates to malnutrition. Here option C is the correct answer. Next we will move on to continuous question number 18. In Nanda, 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 what is PES from the following? According to Nanda, what is PES from the following? NANDA. According to Nanda means we all know. Nanda means North American Nursing Diagnosis Association. In 90% of our nursing diagnosis, we are framed by the Nanda diagnosis by using the method of Nanda diagnosis only. According to Nanda, the PES from the following means we will see here option A problem etiology, signs and symptoms, option B promotion etiology, signs and symptoms, option C protection etiology, signs and symptoms, option D prevention etiology, signs and symptoms. Here PES means problem etiology, signs and symptoms. The PES statement is a structured sentence that describes the specific nutrition problems that you are is responsible for the treating and working towards resolving the causes of problem and the evidence that is problem exists. So here through the PES in the Nanda, according to Nanda, by using the PES, problem etiology, signs and symptoms, we can work towards resolving the causes of problem and the evidence that this problem exists. Problem etiology, signs and symptoms is an acronym that stands for problem etiology, signs and symptoms. Here option A is the correct answer. Next we will move on to question number 19. What is the nurse role during the phototherapy? What is phototherapy? The nurse role in during the phototherapy we will see now. We will see first option. Option A, face should be covered. Option B, baby should be covered. Option C, eye and genital or should be covered. Option D, no need to cover the baby. So here phototherapy. What is phototherapy? Phototherapy is treatment with a special type of light, not sunlight. It is a special type of light. It is used to treat newborn jaundice by making it easier for the baby's liver to break down and remove the bilirubin from the baby's blood. Phototherapy is generally very effective for newborn jaundice and has less effects also. Nurses are expected to evaluate and monitor the neonate as part of newborn assessment in the ABGA score itself. We will see the aims of phototherapy. To expose baby's skin to as much light as possible. The nurse responsibility during the phototherapy, nurse should remove the baby's cloth and with gauze or eye pads close the eyes and genital areas. Weight and height monitoring, breastfeeding and explain. The nurse should explain and educate the parents about phototherapy and also explain the importance of breastfeeding during the phototherapy. So here the nurse role during the phototherapy is option C, eye and genital area should be covered. So here option C is the correct answer. Next we will move on to last question in this video, 20th question. Expressed breast milk can be stored at temperature. Means the expressed breast milk can be stored at the room temperature for how much of hours? Here we will see option A only 1 hour, option B 2 to 3 hours, option C 4 to 8 hours, option D 12 hours. Freshly expressed or pumped milk can be stored at the room temperature 77 degree Fahrenheit or colder for up to 4 hours. In refrigerator for up to 4 days. In freezer for about 6 months is best, but we can store up to 12 months in freezer is acceptable. In room temperature, EBM, expressed breast milk, is also called as EBM. EBM best used within 4 hours but may be safe for up to 8 hours. If it is expressed in a sanitary manner means we can use. After expressing breast milk, in case of breast milk we are taking from the freezer or refrigerator. Means we have to warm the milk before feeding the child. How we will warm the breast milk? I will explain now. Place the bottle in the bowl of warm water or run it under the warm water. Then the milk will little bit warm and then we can feed baby through the palade or other method. So here the expressed breast milk can be stored at the room temperature for the 4 to 8 hours is the correct answer here. This is the last question in this video. In the child health nursing we are discussing now. This is part 1. We already completed introduction related to the child health nursing and FAQs and very important questions 20 questions with detailed explanation done in this part 1 video. Next part 2 we will continue from the 21 to further questions in part 2 video. Thank you so much for watching my video. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Please give a like. Stay tuned friends. Thank you.